And so, Dr. Brainard, tell us about probiotics, and do they really work for tummy distress and?
Probiotics are encapsulated forms of the bacteria that normally live in your intestinal system. Believe it or not, there are a larger number of bacteria living in your colon than there are cells in your entire body, which is a really sort of weird thing to think about. But we have a lot of bacteria that live on our skin, and we have a huge number of bacteria that live in our intestinal system. And it turns out that those bacteria, actually, their DNA signals our bodies with certain inflammatory or anti-inflammatory signals. And we have found that certain strains of probiotics can actually help improve your emotional well-being. There are studies showing that giving probiotics to people who are depressed actually helps their HAM2 depression scores get better.
Wow,
so I didn't know that. That's fascinating, really.
We know that it has much more far-ranging aspects than just keeping you from getting antibiotic-associated diarrhea, which we know is very important. Saccharomyces boulardii, taken when you're taking antibiotics, will help prevent C. difficile colitis, which can actually be a killer of people. So probiotics.
Not to mention really, really miserable.
Oh, terribly miserable. Nasty, awful, crampy diarrhea that puts you in the hospital for some time. But probiotics are found to be important in infantile colic.
Boy, I could have used that with my first child.
There's a good study that shows that if you give probiotics to babies in the first year of life, their incidence of, or first week of life, excuse me, their incidence of developing colic by 6 weeks is much less than if they did not. We know that babies who are born to moms through the vaginal birth canal, of course, are colonized with a different set of bacteria than those that just come through the skin through a cesarean section. And probiotics may be more important in those babies too. But even for those of us in adulthood, taking probiotics to help maintain that balance, especially after you've taken antibiotics, is really important for your immune system functioning, for your neurological functioning, as well as for just your gut health.